Hello, everyone. This is Dr. Alan Mandell. If you or someone you love is dealing with high blood pressure, I want you to listen very carefully because what I'm about to share with you is simple, natural, and extremely powerful. High blood pressure is not just a number on a machine. Over time, it quietly damages your heart, your kidneys, your brain, and your blood vessels. And as we age, this becomes even more important. The good news, your body is incredibly intelligent, and when you give it the right foods, it knows exactly how to heal. Today, I'm going to share with you the top 5 legumes every senior should be eating to naturally support healthy blood pressure, improve circulation, reduce inflammation, and strengthen the heart without side effects. When we talk about lowering blood pressure naturally, especially as we get older, we have to understand something very important. The body is not broken. It is responding to years of stress, inflammation, poor circulation, and nutritional deficiencies. And one of the most powerful ways to support the body without shocking it or overwhelming it is through the foods we eat every single day. Legumes are one of those foods. They don't work like a drug. They work like nourishment. Slowly, consistently, and intelligently, they give the body exactly what it needs to relax blood vessels, reduce internal pressure, and restore balance to the cardiovascular system. High blood pressure is often the result of tight, inflamed, and stiff arteries. Over time, blood vessels lose their ability to expand and contract easily. When that flexibility is gone, the heart has to work harder to push blood through, and pressure rises. Legumes address this problem at its root. One of the key reasons legumes are so effective is their mineral content, especially potassium and magnesium. These minerals act as natural relaxants for the muscles surrounding the blood vessels. When those muscles relax, the vessels open slightly. Circulation improves and pressure drops. This is not forced. It's a natural response your body is designed to make when it receives the right nutrients. Legumes are also rich in soluble fiber, which plays a critical role in blood pressure regulation. Fiber helps bind excess sodium in the digestive system and escorts it out of the body. Too much sodium causes fluid retention, and excess fluid increases pressure inside the arteries. By gently reducing sodium load, legumes help normalize blood volume and ease strain on the heart. Another powerful benefit of legumes is their effect on inflammation. Chronic low-grade inflammation is one of the silent drivers of high blood pressure, especially in seniors. Over the years, inflammation damages the inner lining of the blood vessels, making them rigid and narrow. Legumes contain a wide range of antioxidants and plant compounds that help calm this inflammation and protect the delicate endothelial lining of the arteries. When the inner lining of the blood vessels is healthy, the body can produce nitric oxide more efficiently. Nitric oxide is a signaling molecule that tells blood vessels to open and relax. Many seniors produce less nitric oxide as they age, which contributes to poor circulation and elevated blood pressure. Certain amino acids and polyphenols found in legumes help support this natural process, allowing blood to flow more freely with less resistance. There is also an important connection between blood sugar and blood pressure that often gets overlooked. Spikes in blood sugar lead to spikes in insulin, and chronically elevated insulin causes the kidneys to retain sodium. This retention raises blood pressure. Legumes digest slowly, release glucose gradually, and help stabilize blood sugar levels. By improving insulin sensitivity, they indirectly reduce one of the major hormonal triggers of high blood pressure. For seniors, this slow and steady effect is especially valuable. The body no longer responds well to extremes. It thrives on consistency. Legumes provide sustained nourishment without sudden changes that can stress the cardiovascular system. Another benefit is weight regulation. Even modest weight gain can increase blood pressure by placing extra demand on the heart. Legumes are filling, nutrient, dense, and satisfying, helping seniors maintain a healthy weight without deprivation. When the heart doesn't have to work as hard to supply a larger body mass, pressure naturally decreases. Gut health also plays a surprisingly large role in blood pressure control. The fiber in legumes feeds beneficial gut bacteria, which produce compounds that reduce inflammation throughout the body. A healthier gut leads to a calmer immune response, better nutrient absorption, and improved vascular function. When the gut is inflamed, the entire body suffers, including the heart and blood vessels. What's important to understand is that legumes don't just lower a number on a blood pressure cuff. They support the entire system that regulates blood pressure. They nourish the heart, protect the arteries, support the kidneys, stabilize hormones, and reduce inflammation all at the same time. This is why the effects may not feel dramatic overnight, but over weeks and months, many people notice their readings becoming more stable, their circulation improving, their energy increasing, and their dependence on interventions slowly decreasing under medical guidance. For seniors, this gentle approach is exactly what the body needs. No shock, no force, just consistent support. The key is regular intake in reasonable portions prepared simply and without excess salt. When legumes become a normal part of the diet, not a temporary fix but a lifestyle choice, the body begins to respond in ways that are both measurable and deeply healing. Your body remembers how to heal when you give it the tools. As we age, one of the most significant changes that occurs inside the body is what happens to our blood vessels. They are no longer as flexible as they once were. Over time, arteries can become stiff, narrow, and less responsive, and this places a tremendous amount of stress on the heart. When the heart has to push blood through rigid vessels, blood pressure rises. This process happens slowly and silently, which is why so many seniors don't feel anything until a problem appears. The goal is not just to lower blood pressure numbers, but to support the health of the arteries and the heart itself. This is where legumes play an incredibly important role. Legumes provide nutrients that directly support the structure and function of blood vessels. One of the most important of these nutrients is fiber. Fiber helps reduce LDL cholesterol, which is known to damage the inner lining of arteries. When cholesterol builds up along artery walls, it creates stiffness and resistance. By helping remove excess cholesterol from the bloodstream, legumes protect the arteries and help maintain their elasticity. Healthy arteries are elastic arteries. They expand with each heartbeat and gently contract as blood moves forward. This natural movement keeps pressure balanced. When arteries lose this flexibility, pressure builds. The minerals and plant compounds in legumes help preserve this elasticity by reducing oxidative damage and inflammation over time. Antioxidants found in legumes are particularly important for seniors. Oxidative stress increases with age and damages cells throughout the body, including the cells that line blood vessels. When these cells are damaged, arteries become rough and inflamed, making it harder for blood to flow smoothly. Legumes contain polyphenols and flavonoids that help neutralize free radicals and protect the vascular system from further damage. The heart itself also benefits greatly from legumes. Plant-based proteins found in legumes are easier on the heart than many animal proteins. They provide essential amino acids without the saturated fats that can contribute to arterial plaque and inflammation. This reduces the workload on the heart and supports more efficient pumping with less strain. Another critical factor in heart health is potassium. Potassium helps counterbalance the effects of sodium in the body. As we age, the kidneys may become less efficient at removing excess sodium, which leads to fluid retention and increased blood pressure. Legumes provide potassium in a natural form that helps the body maintain proper fluid balance, reducing pressure on both the heart and blood vessels. Magnesium, another mineral abundant legumes, plays a key role in regulating heartbeat and relaxing smooth muscle tissue in the arteries. Low magnesium levels are common in seniors and are associated with increased arterial stiffness and irregular heart rhythms. By replenishing magnesium stores, legumes help support a steady heartbeat and smoother blood flow. There is also a strong connection between inflammation and heart disease. Chronic inflammation causes the heart to work harder and accelerates the aging of blood vessels. Legumes help lower inflammatory markers in the body by supporting gut health and reducing the production of inflammatory compounds. A calmer immune system translates into healthier arteries and a stronger heart. Blood sugar stability is another often overlooked factor in cardiovascular health. Repeated blood sugar spikes damage blood vessels and increase the risk of heart disease. Legumes slow digestion and help prevent sharp rises in blood sugar, protecting the delicate vascular system from damage. Over time, this reduces stress on the heart and preserves arterial integrity. For seniors, maintaining circulation is essential. Poor circulation leads to cold hands and feet, fatigue, dizziness, and reduced oxygen delivery to tissues. The nutrients in legumes support better circulation by keeping blood vessels open and flexible, ensuring that oxygen and nutrients reach every part of the body efficiently. What makes legumes especially valuable is their gentle cumulative effect. They don't overstimulate the heart or cause sudden changes in blood pressure. Instead, they provide steady nourishment that supports the cardiovascular system day after day. This is exactly what the aging body responds to best. When seniors consistently include legumes in their meals, they are not just eating food. They are actively supporting their heart and arteries in a way that aligns with the body's natural healing processes over time. This support can lead to improved endurance, more stable blood pressure readings, and a greater sense of vitality. The heart does not ask for complicated solutions. It asks for proper nourishment, reduced inflammation, and balanced circulation. Legumes offer all of this in a simple, natural form. When you support the arteries, you support the heart. And when the heart is supported, the entire body benefits quietly, steadily, and naturally. One of the most overlooked reasons blood pressure rises as we get older has very little to do with the heart itself and everything to do with balance inside the body, specifically blood sugar, balancing sodium balance. These two factors quietly influence blood pressure every single day, and when they are out of control, no amount of effort aimed only at the heart will fully solve the problem. As we age, the body becomes less efficient at handling blood sugar. Cells don't respond to insulin as well as they once did. So, the pancreas releases more insulin to compensate. This condition, known as insulin resistance, is extremely common in seniors, even in those who are not diabetic. What many people don't realize is that high insulin levels directly raise blood pressure. Insulin tells the kidneys to retain sodium. When sodium is retained, water follows. More water in the bloodstream means more volume, and more volume means more pressure pushing against the artery walls. This is one of the most common hidden causes of high blood pressure in older adults. Lead units address this problem in a very gentle but powerful way. They digest slowly, they release glucose gradually, they prevent sharp spikes in blood sugar that force the body to release large amounts of insulin. When blood sugar remains stable, insulin levels stay lower, and the kidneys are no longer signaled to hold on to excess sodium. This is not a dramatic process. It is subtle, consistent, and deeply supportive, exactly what the aging body responds to best. The fiber in legumes plays a major role here. Soluble fiber forms a gel-like substance in the digestive tract that slows the absorption of carbohydrates. This means glucose enters the bloodstream at a controlled pace rather than flooding it all at once. Over time, this improves insulin sensitivity, allowing cells to respond properly. Again, when insulin sensitivity improves, the entire hormonal environment of the body begins to calm down. The stress response decreases, inflammation decreases, and blood pressure begins to stabilize. Sodium balance is just as important. Sodium itself is not the enemy. Excess sodium combined with poor potassium intake and weak kidney function is the problem. Many seniors consume far more sodium than they realize, especially from processed and packaged foods. At the same time, they often lack potassium, which is essential for counterbalancing sodium's effects. Legumes naturally restore this balance. They provide potassium in a form the body recognizes and uses efficiently. Potassium helps the kidneys excrete excess sodium through urine, reducing fluid retention and lowering pressure within the blood vessels. This process lightens the workload on both the heart and the kidneys. Kidney function becomes increasingly important with age. When the kidneys struggle to regulate fluids and electrolytes, blood pressure often rises as a protective response. Legumes support kidney health by improving blood flow, reducing inflammation, and providing fiber that helps remove metabolic waste from the body. Another important aspect of sodium balance is the condition of the blood vessels themselves. Excess sodium stiffens arteries over time, making them less responsive. When arteries lose their ability to expand, even normal blood volume can create high pressure by helping regulate sodium and reduce inflammation. Legumes protect the flexibility of the blood vessels. There is also a strong connection between gut health and sodium handling. An imbalanced gut microbiome can influence how the body processes salt and fluids. The fiber in legumes feeds beneficial gut bacteria, which produce compounds that improve vascular health and help regulate blood pressure. A healthier gut leads to better overall balance in the body. For seniors, this connection is especially important because digestive efficiency often declines with age. When digestion is compromised, nutrient absorption suffers, inflammation increases, and blood sugar regulation worsens. Legumes gently support the digestive system while providing sustained nourishment. Another benefit of improved blood sugar control is reduced stress on the nervous system. Blood sugar swings trigger the release of stress hormones like cortisol and adrenaline. These hormones constrict blood vessels and raise blood pressure. By keeping blood sugar steady, legumes help keep the nervous system calm and the blood vessels relaxed. This is why many seniors notice not only better blood pressure readings, but also improved energy, fewer crashes, and a greater sense of stability throughout the day when legumes become a regular part of their diet. What makes this approach so effective is that it works with the body, not against it. There is no forcing, no sudden drops, no shock to the system, just steady, consistent improvement. It's also important to understand that blood sugar balance and sodium balance are not separate issues. They are deeply connected. When blood sugar is unstable, sodium retention increases. When sodium is excessive, blood pressure rises. Legumes address both sides of this equation at the same time. This dual support is especially valuable for seniors who may already be taking medications that affect fluid balance or blood sugar under proper medical supervision. Dietary changes that improve natural regulation can sometimes reduce the need for escalating interventions. The body is always seeking balance. It knows how to regulate blood pressure when the underlying systems are supported. Legumes provide that support in a way that is simple, affordable, and sustainable. When seniors consistently include legumes in their meals, they're not just eating for nutrition, they're restoring internal balance. Blood sugar becomes steadier. Sodium is handled more efficiently. Fluid pressure decreases, and the heart no longer has to fight against the body's own chemistry. This is how real lasting change happens, not through extremes, but through intelligent nourishment that respects the body's natural design. When it comes to improving blood pressure naturally, especially in seniors, one of the biggest misunderstandings is the belief that eating more of a healthy food will automatically lead to better results. In reality, the aging body does not respond well to extremes. It responds best to consistency, simplicity, and proper preparation. This is where many well-intentioned efforts fail, not because the food is wrong, but because the approach. Legumes are powerful, but how they are prepared and how often they are eaten makes all the difference. As we age, digestion changes, the production of digestive enzymes slows, stomach acid may decrease, and the gut becomes more sensitive. Large portions of legumes eaten suddenly can cause bloating, discomfort, or gas, leading many seniors to give up on them altogether. This is unfortunate because the problem is not the legumes. It is the lack of gradual introduction and proper preparation. Consistency is far more important than quantity. A small serving of legumes eaten regularly does more for blood pressure than a large serving eaten occasionally. When legumes are consumed consistently, the body begins to adapt. Digestive enzymes increase, beneficial gut bacteria multiply, and nutrient absorption improves. Over time, legumes become easier to digest and more effective. Preparation plays a critical role in this process. Dried legume should be soaked before cooking. Soaking helps remove compounds that can interfere with digestion and mineral absorption. It also shortens cooking time and makes the legumes gentler on the digestive system. Discarding the soaking water and cooking them in fresh water is a simple step that can dramatically improve tolerance. Cooking legumes thoroughly is equally important. Undercooked legumes are much harder to digest and can irritate the gut. Proper cooking breaks down complex carbohydrates and makes nutrients more bioavailable. For seniors, softer textures are easier to chew, swallow, and digest, reducing strain on the digestive tract. Canned legumes can be convenient, but they often contain excessive sodium. If canned legumes are used, they should be thoroughly rinsed to remove as much sodium as possible. This step alone can significantly reduce sodium intake and make legumes more supportive of healthy blood pressure. Seasoning also matters. Adding herbs and spices such as garlic, ginger, cumin, turmeric, and bay leaf not only enhances flavor, but also improves digestion and reduces gas formation. These herbs support circulation, reduce inflammation, and complement the blood pressure-lowering effects of legumes. Another important factor is how legumes are combined with other foods. Pairing legumes with vegetables, healthy fats, and herbs creates a balanced meal that is easier on blood sugar and digestion. Avoiding heavy combinations with processed foods or excessive